Dentures are not a replacement for teeth. Dr. Kennedy likes to say they're a replacement for no teeth. Complete denture would be something where a patient's missing all the teeth in that arch, so it would restore everything. Whereas a partial denture would just be replacing 1, 2, 3, a couple teeth, that sort of thing, where you still have remaining teeth that you can grab onto. A implant supported denture, an overdenture, some people call it, is when a complete denture snaps into 2 implants. And that's a great option because generally a complete denture, the patient has about 30% of the chewing power as they do with natural teeth. So implant supported denture is great. A fixed hybrid prosthesis would be, where you have several implants on one arch and then you have something that stays in there, something that's fixed. That is a great option, and a lot of patients are going for that nowadays. Being able to educate the patient and identify what suits them best is what we're trying to do, and just communicate and be on the same page with the patient. Dentures are the number one complaint we would have about them is the rubbing on the tissue. So we want to make sure they're nice and comfortable. We would remove any high spots. We can adjust them. Generally, any sort of adjustment would be included in having a denture made by us at Kennedy Dental. And we also want to work with the lab to make sure it looks natural. So if that means having a different color of pink acrylic or a different color of tooth, we want to make sure that the patient has an aesthetic outcome that they're happy with. Because some people don't want their dentures to look fake, they want them to look real. So maybe we'll have the lab change the teeth in a certain way. They'll be crowded or rotated, or they can be perfectly straight, whatever the patient wants. But we can literally customize every part of the denture, and it's really sophisticated.